kidney disease we primarily divide into two broad headings: acute kidney disease and chronic kidney disease. And as the term suggests, acute kidney disease means kidney disease happening within few days or 1 or 2 weeks. And most of the acute kidney disease are potentially reversible. So it may be serious enough that patient require dialysis, but still these are potentially reversible. But against acute kidney disease, chronic kidney disease is a state where the kidney disease is persisting for beyond 3 months in absence of a reversible factor, and these are usually progressive disease, which means that it can happen from milder degree of a chronic kidney disease to severe degree. So chronic kidney disease, there are 5 stages of chronic kidney disease. Stage 5 is a stage when the medical treatment will not be able to maintain the patient, and most of the patient of stage 5 require dialysis and or kidney transplant. So now coming to early stage 1, 2 and 3, in majority of patients are asymptomatic. So actually they don't have any symptom, and this form 90% of all CKD, which means that we can diagnose stage 1, 2 and 3 if we specifically look for the chronic kidney disease. Still, to make it little simpler, although majority of stage 1, 2 and 3 are asymptomatic, the early sign of obvious chronic kidney disease is any person who has got a high blood pressure may be sign of chronic kidney disease. Any person who has got swelling over the body, leg swelling or hand or face swelling is also a patient who may have chronic kidney disease. Patient who has got anemia, for which there is usual causes of anemia, low hemoglobin is not found, that patient may have a chronic kidney disease. Or persons who has got bone pain or a fracture with a minimum trauma may have chronic kidney disease. And the patient who has obvious symptom of abnormal urine, like blood in urine or pus in urine, or they are passing more frequently urine, more so in the night time, they may have a chronic kidney disease. So these 5 symptoms are signs of chronic kidney disease. We cannot say it is early sign, because these signs are usually in little advanced, which means stage 3 and 4 chronic kidney disease. Issue of reducing the risk of patient from going early stage to late stage, probably much more important will be to pick up the patient in early stage. Only then the question of reducing the going to stage 5 comes. So as I told you that patients are usually asymptomatic, so which means we need to screen the patient for chronic kidney disease. There is a group of patients where there is a higher risk of developing chronic kidney disease, what we call high risk group for chronic kidney disease. Now what is the high risk group? Any patient who has got diabetes, any patient who has got high blood pressure, or patient who is above 60, or the patient in whose family first degree relative have already chronic kidney disease, and the patient who have got past history of acute kidney disease. Because although I have said that acute kidney disease patients are potentially reversible, approximately 15 to 20% patients of acute kidney disease go into chronic kidney disease. So these are the 5 high-risk group for chronic kidney disease, and we recommend that these high-risk group should be screened for chronic kidney disease by urine examination for excess protein in the urine. A basic dictum is that earlier we diagnose the patient, we can prolong the time of reaching to stage 5. Like diabetes and high blood pressure, 2 are commonest causes of 60% patient of chronic kidney disease. So once we diagnose in early stage, treatment of primary disease causing chronic kidney disease becomes an important factor to prevent progression of chronic kidney disease, which means a very good control of diabetes and very good control of blood pressure These are the two key factors for retarding the progression of chronic kidney disease. Other than that we do some changes in the diet, like we request the patient to decrease the protein in the diet, and patient do not take excess protein, do not take excess salt, and if diabetes, then control diabetes. So these are the major factors for retarding progression of chronic kidney disease. There are some basic concepts to prevent chronic kidney disease. One is that person should do regular exercises and should not become obese. So keep a ideal weight. Number two, take a adequate quantity of water, which for a normal adult is 1.5 to 2 liters of fluid. Number three, if the diet needs to be controlled, and in diet we should not take excess salt, because that will help in prevention of development of a high blood pressure and then secondary chronic kidney disease. We should not take too much of a fat and carbohydrate, because that will lead to the diabetes and then secondarily affect the development of diabetes and chronic kidney disease. And we should not take excess protein, and particularly excess non-vegetarian protein, because that leads to extra load for filtering unit of the kidney and causing kidney damage.